Hey everyone, Dr. Ross here. And today we're diving into a topic that's crucial for everyone to understand: strokes. Recognizing the warning signs of a stroke early on can be the difference between life and death. Knowing this information could potentially save your life or the life of someone you love. So let's get right into it and break down the top 10 warning signs of a stroke. Stay tuned and take notes. The first warning sign is sudden numbness or weakness, especially on one side of the body. This can affect your face, arm, or leg. Imagine going about your day and suddenly your arm feels weak or numb, or one side of your face starts to droop. This is your body sounding the alarm. A stroke occurs when blood flow to a part of the brain is interrupted. This deprives brain cells of oxygen and nutrients, causing them to die within minutes. When this happens, the part of the body controlled by that area of the brain can't function properly. Think of it like a power outage in your house. If a circuit breaker trips and cuts off power to a room, the lights in that room go out. Similarly, when blood flow to a part of the brain is disrupted, the functions controlled by that part of the brain are affected. If you experience sudden numbness or weakness, especially on one side of the body, don't wait to see if it passes. Time is critical when it comes to strokes. The second critical warning sign: sudden confusion, trouble speaking, or difficulty understanding speech. Imagine trying to speak, but the words just won't come out right, or you're hearing others speak, but their words sound jumbled. This is a clear indication that something is disrupting the brain's normal function. The areas of the brain responsible for language and communication are incredibly complex. When a stroke occurs, these areas can be affected, leading to a range of speech and language problems. You might find yourself struggling to find the right words, or your speech might become slurred. In some cases, people experiencing a stroke may have difficulty understanding what others are saying. If you notice that someone is suddenly having trouble speaking, understanding you, or seems confused, don't dismiss it. These could be signs of a stroke in progress, and time is of the essence. Call for help immediately. The third warning sign: sudden trouble seeing in one or both eyes. Imagine reading a book and suddenly your vision blurs or you lose sight in one eye. It's like someone just pulled a curtain over part of your visual field. The visual cortex, the part of the brain responsible for processing visual information, is highly dependent on a constant supply of oxygen-rich blood. When a stroke occurs and blood flow to this area is disrupted, it can lead to a range of visual disturbances. You might experience blurred vision, double vision, or even complete loss of vision in one or both eyes. These visual disturbances can be temporary or permanent, depending on the severity of the stroke and how quickly treatment is received. If you experience sudden vision changes, especially if they're accompanied by other stroke symptoms, seek medical attention immediately. Don't wait to see if your vision clears up on its own. Every minute counts when it comes to stroke treatment. The fourth warning sign: sudden trouble walking, dizziness, loss of balance, or lack of coordination. Imagine feeling like the room is spinning, or you're suddenly off balance, stumbling as you walk. These sensations can be extremely unsettling and are often early indicators that something is amiss in the brain. Our sense of balance and coordination relies on a complex interplay between different parts of the brain. When a stroke occurs and blood flow to these areas is disrupted, it can lead to a sudden onset of dizziness, loss of balance, and difficulty walking. You might feel unsteady on your feet, like you're about to fall. If you experience a sudden onset of dizziness, loss of balance, or trouble walking, especially if it's accompanied by other stroke symptoms, seek immediate medical attention. Don't try to tough it out or dismiss it as something minor. Time is of the essence when it comes to stroke treatment. Early intervention can significantly improve your chances of a full recovery. The fifth warning sign: sudden severe headache with no known cause. Imagine going about your day and suddenly it hits you. A blinding, excruciating headache that seems to come out of nowhere. This kind of headache, often described as the worst headache of my life, is a serious warning sign that should never be ignored. While the exact mechanism behind stroke-related headaches is not fully understood, it's thought that the sudden increase in pressure within the brain can trigger intense pain receptors. This type of headache is different from a typical tension headache or even a migraine. It's often described as explosive or thunderclap-like in its onset. If you experience a sudden severe headache that's different from any headache you've had before, especially if it's accompanied by other stroke symptoms, seek immediate medical attention. It's always better to err on the side of caution when it comes to your health. Prompt medical evaluation can help determine the underlying cause of your headache and ensure you receive appropriate treatment. The sixth warning sign, sudden numbness or paralysis in the face. Have you ever seen someone whose smile seems lopsided or one side of their face droops? This is a classic sign of facial paralysis, which can be caused by a stroke. When a stroke affects the part of the brain that controls facial muscles, it can lead to weakness or paralysis on one side of the face. This can make it difficult to smile, frown, or raise your eyebrows normally. There's a simple test you can do to check for facial droop called the facial droop test. Ask the person to smile. Do you notice one side of their mouth drooping? Ask them to raise both eyebrows. Can they raise both eyebrows evenly? Ask them to puff out their cheeks. Does one cheek seem weaker than the other? If you notice any asymmetry or difficulty performing these actions, it could be a sign of facial paralysis and a possible stroke. Seek immediate medical attention. The seventh warning sign, limb weakness. Imagine trying to lift both your arms above your head, but one arm drifts downward. This is a classic sign of arm weakness, often referred to as arm drift, which can be a strong indicator of a stroke. When a stroke occurs and disrupts blood flow to the part of the brain that controls motor function, it can lead to weakness or paralysis in the limbs. There's a simple test you can do to check for arm weakness, called the arm drift test. Ask the person to close their eyes and hold both arms straight out in front of them, palms facing up. Observe their arms for about 10 seconds. Does one arm drift downward? If you notice one arm drifting downward, it could be a sign of arm weakness and a possible stroke. Seek immediate medical attention. The eighth warning sign, difficulties with comprehension or mental confusion. Imagine feeling like you're in a fog, struggling to follow conversations, or having trouble remembering simple things. These cognitive changes can be early signs of a stroke, especially when they occur suddenly. When a stroke occurs, it can affect different areas of the brain, including those responsible for memory, language, and thought processing. This disruption can lead to a range of cognitive difficulties, making it challenging to think clearly, understand information, or communicate effectively. If you notice that someone is suddenly having trouble understanding you, seems confused, or is acting out of character, don't dismiss it. These could be signs of a stroke in progress, and time is of the essence. The brain is incredibly sensitive to a lack of oxygen, and every second that passes without treatment can lead to further damage. Call for help immediately. The ninth warning sign, unexplained dizziness or sudden falls. Imagine walking and suddenly you feel dizzy, lightheaded, or unsteady on your feet, leading to a fall. Or perhaps you witness someone trip and fall for no apparent reason. While falls are common, especially among older adults, sudden unexplained falls can be a red flag for a stroke. When a stroke occurs and blood flow to the brain areas responsible for balance is disrupted, it can lead to a sudden onset of dizziness, vertigo, loss of balance, and an increased risk of falls. In some cases, dizziness or a fall might be the only warning sign of a stroke. If you experience sudden, unexplained dizziness or falls, especially if it's accompanied by other stroke symptoms, seek immediate medical attention. Don't hesitate to seek immediate medical attention. Early intervention can significantly improve your chances of a full recovery. The 10th warning sign, sudden severe nausea or vomiting. Imagine going about your day and suddenly you're hit with a wave of nausea, followed by intense vomiting. This type of nausea and vomiting is different from the kind you might experience with the flu. It's often more severe, comes on suddenly, and may be accompanied by other stroke symptoms like a headache, dizziness, or vision changes. When a stroke occurs in certain parts of the brain, particularly the brainstem, it can disrupt vital functions and trigger nausea and vomiting. If you experience sudden severe nausea or vomiting, especially if it's accompanied by other stroke symptoms, seek immediate medical attention. It's always better to err on the side of caution when it comes to your health. Prompt medical evaluation can help determine the underlying cause of your symptoms. Ensure you receive appropriate treatment. That covers the top 10 warning signs of a stroke. Recognizing these signs and taking swift action can be the difference between life and death. If you or someone you know experiences any of these symptoms, even if they seem to pass quickly, don't wait. Call 911 immediately. Share this video with your friends and family. Spreading awareness about stroke symptoms is crucial and could potentially save lives. Remember, time lost is brain lost. Acting fast can make all the difference. Thanks for watching Health Facts.